Dear all viewers, we are happy to share a person with you who is a faculty in neurology, pediatric neurology. So he is going to talk about the headache in pediatric age and adolescent. He is Dr. Pravin Kumar from New Delhi. Headache is so common throughout the day for everything, anything, and for nothing.
Mhm. Very true.
And in all human beings across the world. Expert faculty is going to give you clues how to remove the headache. बट एक पुरानी कहावत है बहुत अच्छी सी हिंदी की, अगर आपको हेडेक है तो इसका मतलब ये है कि आपके पास हेड तो है,
Very true.
अगर हेड ही नहीं होगा तो हेडेक क्यों होगा. और
Mhm.
पढ़े लिखों में तो ज़्यादा से ज़्यादा ही हेडेक होता है.
True. Very true, sir.
प्रोफेसर प्रवीण कुमार is MBBS DCS DNB Pediatrics, is postdoctorate fellowship pediatric neurology, senior consultant and head division of pediatric neurology, Institute of Child Health in Sir Ganga Hospital, New Delhi, a very famous hospital of New Delhi of our India, of our country. His area of interest is refractory epilepsy and stroke and CNS demyelination. Major achievement: Secretary AOPN Delhi, Best Senior Resident Award in the hospital, Young Achiever Award Delhi, Most Trusted Pediatric Neurologist Delhi 2023, Medical Icon Award DMC 2025, author of book Manual of Pediatric EEG, which I also have got it, co-author Handbook of Pediatric EEG, more than 50 paper publication and 5 book chapters. Organized Secretary, Annual Pediatric Neurology Update, Sir Gangaram Hospital. Achievement, a book on manual of EEG, he was awarded. These are the achievements he received in all these as a young pediatric neurophysician from our country. Our aim of life, update society by this Dr. Tuteja Talk Show. If you like, subscribe our channel so that you get the updates without information from YouTube. They are all podcasts you can see anytime in your leisure hours. So nothing is like that you disturb your routine. Your suggestion, comments are always welcome and we will definitely like to endorse them. So with Dr. Praveen ji, I would like to ask how common is the headache in pediatric and in adolescent?
Okay. So very good afternoon to you, sir. And I'm very privileged and happy to be invited by you for your very famous, popular and educative talk show. And as nicely put that headache can be there throughout the day without having any reason also, as you mentioned in the beginning only. So, I mean, headache is a very common neurological disorder. In fact, this is one of the most common cause for our pediatric neurology OPD visits. And contrary to popular belief that children do not get headache, and why should a child should why a child should get headache? The headaches are very common in pediatric population. Almost there have been literature saying about almost 60% of the pediatric patients can headache. They get the headache part. As the age advances, you are more prone to get the headaches. So this is slightly more common in the maybe the teenagers, adolescents as compared to the very younger group on the part. But very common, sir.
Yeah. What are the common causes? मतलब अपन जैसे फीवर में तो देखते ही हैं कि any fever with headache, but there are many other causes which definitely parents would like to know, and the pediatricians also, if something is missing in when they are examined.
True, sir. So I think, as you rightly said, that the fever and headache, this is the most common cause for headache in amongst all the group on the part. We call them as a kind of like fever-induced headache or febrile toxic headache in those circumstances where the fever goes and the headache also goes off on the part.
Hmm.
When we try to understand the causes of the headache, so there are two primary divisions of headache causes. So one, we understand it is like a primary headache disorders, where headache is in itself a disorder which is being manifested on the part. And the second is the secondary headache disorders, where headache is a manifestation of something else happening in the body, like as you mentioned, fever causing headache, or maybe the meningitis causing headache, or maybe a brain tumor causing headache, or intracranial hemorrhage causing headache, of so on and so forth on the part. So apart from fever causing headache, the other secondary causes of headache are very less common. Although they are more dangerous, they are slightly more kind of like anxiety provoking both for the doctors also and for the parents definitely alike, but they are definitely less common causes of so far as the headache is concerned. But at the same time, they are to be evaluated first so that we are not missing any of those serious underlying cause of the headache on the part. So be it like
Very true.
meningitis, intracranial tumors, intraparenchymal hemorrhages, or any venous sinus thrombosis, stroke like manifestations, those ones on the part. The
Hmm.
primary headaches, where the two more common are like migraine and tension type headache, they are also very common. Headaches. Again, not very common popular belief, but migraine is quite common. Tension type headache is very common on the part. The third primary headache is like cranial neuropathies, what we understand like trigeminal neuralgia is on the part. Fortunately, that is less common in pediatric population, pediatric age group on the part.
Hmm. Yeah. So, what are the any association with the refractive error and the sinusitis with the headache?
So this is very, commonly, what to say, maybe the overdiagnosed, many a times undiagnosed also condition. So refractive error can contribute to headache on the part, but mostly as we understand that refractive errors, any pain between the your head and the occiput, that becomes an headache on the part. So pain in this location is a part of your headache. So that's a popular thing. That's why if you get pain in the facial location, in the eyes, in the ears, they all can be a part and parcel of your headache part. And anatomically, we must look for pain coming for these sources, like from the eyes, from the nasal, from the ear, from the teeth, gums, because they can also be contributing to your headache. Apart from like the brain, where the main interest lies on the part. So as you nicely asked, sir, that refractive error can also be contributing to the headache on the part. That's the one thing. But mostly they have got a very significant pattern. So pattern, because refractive errors are mainly because of the maybe the children's growing age, where the muscles are not appropriately developed on the part, or maybe because of some other like excessive skin use and those ones. So they normally causes a kind of like tension in the ciliary muscles, and you get the kind of like headache which is more common in the forehead location, more common in the second half of the day, more common
Hmm.
after maybe prolonged kind of like reading, studying, and concentrating with your eyes on the part. So they are kind of like common causes of the headache, and you come to know because their pattern is more over the frontal location, more with the studies part, and they give you that kind of like phenotypical variations. So a child should always be screened for refractive error. If it is coming for the kind of like headache, then definitely it must be evaluated on the part in the correct testing. Second, the sinusitis and the headache, again, because sinuses are all around the face, they can also contribute to pain in these locations on the part, depending upon which sinuses are involved. Like ethmoid, frontal sinuses can give rise to your periorbital and the retroorbital pain. Sphenoid sinuses can give rise to retroorbital pain. Maxillary sinus can give rise to pain in the facial locations on the part. So definitely they can have a kind of like pain in around the face location. So we have got a condition like sinus headache, which can be contributing. But we
Hmm.
all understand as the pediatricians that these sinusitis will also have the other features of sinusitis. So like maybe like the eye discharges, the tearing, the nasal discharges, on that part. Maybe the facial tenderness when you poke the face because of the sinus involved, you will have the tenderness over there on the part. So you will have other telltale signs of sinusitis also apart from the headache, and somehow you can judge it. This is because of the kind of like underlying secondary causes which is contributing to because of the systemic features. So in a nutshell, they can all, both the refractory error and the sinusitis can contribute to the headache part in a way. But most often you'll find, having said that, most often you'll find that the headache in children are not primarily because of these. They are primarily because of those primary headache disorders, like because of the migraine or tension type headache, which are missed, maybe initially missed as a refractive headache or maybe the sinus headache. And I'll also add that cervical headache. A lot of people also say about, "Okay, my headache is because of cervical part," in a way. So they are not the true causes for the headache in those cases.
Hmm. So, to proceed further, when to say that this is a serious need for the urgent checkup with the headache?
That is important, sir. That is important. Especially, I feel that children, especially because they can have headache throughout the day with number of causes on the part. So, like simple thing, I just said that fever can give rise to headaches on the part, and we call this as the most common cause of, headache in the pediatric population. If some child is complaining of headache when the fever has had subsided, then that's the time when we have to look for that. It could be meningitis or the complications of fever which is causing the headache on the part. So headache without having the fever on the part. A
Yeah.
child who's complaining of headache at the middle of the night, so he's getting up with the headache, 2 o'clock, 3 o'clock, 4 o'clock, it must be evaluated on that sort. A child who complains of headache in a very short duration, like only for last 1 month duration, he is getting of headache on the part. We must be looking for a child who complains of headache for more than 6 months, 7 months. They're primarily primary headache kind of disorders. A
Mhm.
headache of 1 month duration, that should be looked for. Headache only at one particular location, that he complains of only headache at this location every time should be looked for. Either he has got something underlying sitting in that location. Hospital
Mhm.
headaches should also be kept closely. Headache with some kind of physical activity like Valsalva maneuver, which can increase the intracranial pressure and you're getting the headache. That should be
Yeah.
looked for. If you're having headaches and you're having some kind of like focal deficits, like
Mhm.
vision problem or maybe like some gait problem. Gait problem is very common. Most of the pediatric brain tumors are sitting in the posterior fossa and they start with the gait problem. So especially I say if someone is coming with the headache and if you're finding that he has got some amount of ataxia, unsteadiness, he's not walking properly on the partner
Mhm.
or the walk has changed from the before, you must evaluate them because that can be the early sign before the whole hydrocephalus develops in those cases.
Mhm.
Certain conditions I feel like children who has some neurocutaneous syndromes like NF, neurofibromatosis, they can get headache on the part. Children on chemotherapeutic agents, children with leukemia, they may not have all the signs but they should be having the headache on the part. So
Mhm.
in the nutshell, a headache at an location which is only at that part, like any particular location, headache at the odd hours, last in the waking up from the sleep, headache which is with some kind of like neurological deficits, headache with some kind of your other systemic signs like skin marks and those ones, they must be evaluated on the part. And having said that, we must look for the blood pressure part also. So many a times
Yeah.
we miss that part, and that could be a kind of like your own signs of cause for the headache part also. Anyway, I think
Yeah.
totally agree, sir, on that part. Yeah.
It is coming up. I think that I investigated in MP, which is supposed to be a poor state, and in 2004-5, we investigated more of the 1,000 children in the schools, and we found 1% hypertension in adolescent.
Oh, that's
That
that.
time, that time. So now with the so much of coaching and children are running from one school to other school, definitely the hypertension is coming up another issue for the headache. You know,
Uh,
and what
that's
do you say
interesting, sir.
about the occipital headache? So many children say कि पीछे से ही सिर दुखता है.
So, why I mentioned about hospital headache particularly is this, that this is not a very common sign of headache. That was the first thing. So,
Yeah.
like, I mean, although we say that something, the head, as you mentioned, that any pain from the frontal to the occiput location, it belongs to
Yeah.
occiput location on the part. But most
Yeah.
of the pain, which is basically because of the primary headache disorders, are basically carried by the trigeminal nerves. So we get
Mm.
pain most often in the frontal location, those
Mm.
maxillary mandibular location on the part. These are basically caused by your cervical nerves on the part. So I think,
Mm.
and we are talking about the serious secondary causes, so like posterior fossa tumors and those ones. So
Mm.
occipital headaches per se are not a very common location where your primary headaches like
Mm.
migraine, which has got a pathophysiology with the trigeminal neuralgia,
Mm.
will manifest its location on the part. So that is why someone compares the occipital headache, which has got a different, I mean, nerve root to carry the sensation, should not be, ignored on the part. I've got many cases where the cerebellar abscesses, cerebellar tuberculomas, at times the posterior fossa tumors also had this hospital headache on the part. Having
Mm.
said that, this is in itself not only a diagnosis on the part. If you're having some other signs along with that, like as you mentioned that headache in the past 1 month only, acute onset of headache, headache coming at the night also, so they also contribute to these features of headache, which becomes a uh,
Mm.
underlying serious etiology.
Mm. How common is a migraine in children and adolescents?
Very common. As a neurologist, because maybe slightly I'm biased about the part because I see the filtered patients. But if you ask me, I will feel that this is very very common on the part in a way.
Mm.
See, and slightly to me in my practice, I think this is much more common than the all those secondary headaches, be
Mm.
it like fever headache and those ones, because they are filtered out, and the serious secondary headaches are very uncommon, like brain tumors and the bleed and those ones. So
Mm.
headache because of migraine is a very common issues. I think we all
Mm.
are aware now. Maybe we can, with your this session, will be much more aware that any headache which is happening in an episodic manner. So like
Mhm.
headache after a gap of 2 days, 3 days, 4 days, 5 days in a child who is neurologically normal,
Mhm.
and it is happening for many months, like as I said to you, more
Mm.
than 6 months.
Mm.
This is migraine unless proved otherwise. So
Mhm.
I personally feel an episodic headache, which is happening after a gap of 2, 3, 4, 5 days or 7 days, for many months now, maybe 5 months, 6 months on the part, in a child
Mm.
who have you have examined and found to be neurologically intact, is
Mm.
migraine unless proved otherwise on the part.
Mm. So what are the distinguishing features from adult migraine and pediatric age and adolescent migraine? Is
This
there any difference between both?
Yeah, this is interesting, sir, because lot of migraineurs in pediatrics, they have got families also with the migraines. Like we'll ask, the mom will say that she also gets the headache, although they relate to because of the cervical or because of blood pressure or because of the family issues on the part in a way. So the first and the most important glaring headache, pediatric migraine headache, is about not having the hemicrania. So like adults or they understand that migraine happens in only one part of the brain. That has been a
Mm.
traditional understanding.
Mm.
The pediatric migraine can be bilateral. That's one thing. Second thing is about it can happen diffusely over the brain. The second thing
Mhm.
is that the duration. The adult
Mm.
migraines are slightly prolonged, while pediatric migraine can even last for more than 15 minutes or only for
Mhm.
half an hour, while adult
Mm.
migraine they last can for many many hours on the part. That's the
Mm.
second thing on the part.
Mm.
Auras are very uncommon in pediatric migraine. What is slightly more common in the adult migraine? Auras like seeing something different, visual hallucinations, seeing
Mm.
dots, blots, and those ones. They're not common in the pediatric migraine as compared to the adult migraine on the part. And fourth,
Mhm.
which I find more interesting is this, that many times because children can't really describe their feeling, what kind of headache they are getting, it is more
Mm.
about their behavioral part by which we understand that a child is having a headache, and that possibly be an headache like migraine in nature on the part because they can't describe. So like a child who gets headache which slightly builds up. So like in an headache starts slowly mild, then becomes moderate, and then it becomes severe in a gradual build up kind of fashion. Then child starts avoiding light, so like he doesn't want to look at the mobile or TV. He has got sound disliking, like doesn't want to listen to the sound. He's looking for some deep dark quiet room, a dark quiet place to go and rest. Has some nausea and vomiting. They're very characteristic features of pediatric
Hmm.
migraine. If it doesn't tell you, so like we get a lot of kids with the autism or ADHD, or children who are kind of like deaf and mute. If they can't tell you, but even with these kinds of features, if this happening episodically and he rests, he sleeps, he becomes better. That is something like a migraine in nature on the part.
Hmm. So, what are the common triggers which you see in clinical practice?
Um, I feel the sleep deprivation,
Yeah,
exams stress, screen time,
hmm.
missing
We will
meals.
be coming on that very important topic.
Yeah, missing meals, or maybe the meals which are not, I mean, helping you, like kind of foods. Many times they tell you on the part. I feel they
Hmm.
are the most common, I mean, triggers. That is the part. I
Yeah.
understand, I mean, having said that, I understand migraine as a kind of like your inner hypersensitivity to change in the environment on the part. So
Yeah,
every
yeah.
kid has its own kind of like trigger which can give rise to migraine. So a lot of people,
Hmm.
they dance in the disco, they don't get headache. They are sleeping on the platform, they don't get headache basically. They are kind of like fasting, they don't get meals. Our street children, poor, they don't get headache on the part, but if you miss meal you get the headaches. So I think you have got own hypersensitivity which can give rise to your headache. But and that's why the role of making a small diary comes into place, that what is giving rise to headache on the part. But sleep, the screen time, the diet, I think these are three common potential triggers which I come across in our practice.
I feel that the children, adolescents, and adults, those who went out, what they have feeling in the certain environment, they don't get headache. They create headache rather. They create headache for others.
So
So,
that is that's I'll just add one thing, because we all understand as a parent of a kind of like adolescent children that they are kind of like headaches at times because of their growing up on the part. But
hmm,
adolescent in itself is also a kind of like headache causing age, because at adolescent we all understand that they are kind of like they have got a different sleep cycle. They will be
hmm,
sleeping at late, getting up
hmm,
late, their diet
hmm,
pattern changes because of the adolescent hormonal changes also. That is
yeah,
already a time where they are very prone to have those kinds of migraine
yeah,
headaches themselves.
yeah, definitely. So, how do you manage the migraine in children and adolescents? What is
I think
the
first,
management part for that?
yeah, so first thing that they have to understand. But first, we understand that this is a migraine kind of part, episodic headaches on the
Hmm,
part, not other serious secondary causes. Then second
hmm,
thing is this, that they understand what are the potential triggers. Once they start knowing their triggers and start avoiding their triggers, the job becomes much easy. The diet, sleep, and the screen one on the partner. That is the most important part. Third, that which we have to advocate sometimes. Third, that once they get the headache, the most important part is this, like from the pharmacotherapy, that we have to give the analgesics at an appropriate early time, be it like paracetamol, or maybe the paracetamol and the ibuprofen combination on the part, along with some
hmm,
antiemetic, because they've got a lot of nauseas and those parts in a way. And if they're having very frequent headaches, which is disabling, and you'll be surprised to know that the headaches because of migraine is as disabling in a child's life as someone with the rheumatic arthritis, as someone with the cancer. A child with the cancer missing his schools, disabling, is almost similar to the child who gets the headache. Only because the headache of migraine is something which is
hmm,
hidden. It's not apparent to everyone on the part. But this is causing as much kind of like a school missing to his entire career as someone who has got the real disease in that other sort. So,
hmm.
I mean, we need to understand that if he's missing his schools very frequently, missing his activity very frequently, then he may need to put him on some kind of migraine prophylaxis medications. We start calcium channel blockers or some other medication which is used for the migraine prophylaxis on the part.
So, again, coming to, as we are living in a digital era, and everybody, every children from from day one to the my age, I would say, is with the mobile.
हाँ.
So I तो बच्चा जन्म लेता है और माँ बच्चे को कम देखती है, मोबाइल पहले ढूंढती है कि मेरा कोई स्टेटस डालना है। तो 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 what do you say about the mobile? Because it showing the blue light and creating a lot of issues uh, for the headache. So what do you say about it? How
So,
long it should be used or to prevent from the headache?
so, sir, you very rightly said that mobile use has become totally, I mean, very common. We can't totally exclude from our daily life on the part. It's become totally, I mean, it is so much omnipresent that we can't totally exclude it on the part. But
Hmm.
and the second thing is they have done a lot of studies also, and we see practically also with the migraine part that screen time, or we call them like a digital headaches also. So
Hmm.
screen time exposure, length of exposure for screen time is linked with your migraine kind of frequency also on the part. So
Hmm.
I'll just cut the short that if you're having a daily screen time of more than 3 hours, there have been number of studies which have proven that it makes you more prone to have migraine kind of headache and
Hmm.
tension type headache on the part. So
Hmm.
screen time, which is involves your like maybe laptop or mobile or even using your earphones, they can contribute to your headache, especially migraine and tension type headache. Again, because of your excessive use of eye muscles, the frontal muscles, your posture while you are on the screen and those parts. I personally advise them that because you totally can't shut off like in the pollution days. I mean, Delhi also there have been rules about the having the online classes. So you can't totally miss it. But the golden rule which is followed, I mean, across the other places also, different countries also, is 20-20-20. So you keep 2 hours of screen time daily, which is relevant, which is required on the part. But every 20 minutes on the screen, you should be looking out, which is almost around 20 feet away from you for at least 20 seconds. So you just don't spend more than 2 hours in 24 hours on the screen. So you choose what
Hmm.
2 hours you have to spend for the study part. And in that 2 hours, every 20 minutes, you take a break. So I tell them you take a break, you just move around, go to kitchen, have something, drink a glass of water, just go in the balcony, just look out and then come back and then do your work again on the part. So must
Hmm.
rest by every 20 minutes on the things.
So again, then all the children, all the families, educated family, they want to go for a white collar job.
Hmm.
So they everybody wants that every my child should be topper, and so parents are creating stress, or the children are having a stress of examination and studies, running from school to the coaching classes, and then studying, and they are not sleeping before 2 o'clock.
Hmm.
Is I think is another issue in the society which has
True.
come up with the headache
True.
from for parents, for the society, and for the children. What do you say about it?
True, sir. I mean, you rightly said that, I mean, the migraine and this headache, if you take out those serious secondary causes, is a lot lifestyle disease. It's a lot lifestyle disease on the part, and it is a lot preventable and definitely manageable in that aspect once we start understanding what really suits us. So, stress because of your examination, because of your performance, because of your, I mean, results can also contribute significantly to the headache part in a way, because for the simple reason that stress keeps your mind active all through the day. If you are stressed, then again you're going to have a sleep deprivation. If you're sleep deprived, you can get the headache. If you are stressed, your appetite can go wrong. You may be eating something which is not suiting you, the junk foods, all those colas, I mean the cheese and those ones, they can also contribute to migraine kind of headache on the part. So stress in itself and the other factors which comes with the stress can also contribute to the headache part in a way. So they can cause headaches. The number one thing on the parts that we have to understand. Second thing is that we also understand that stress is a part of life. A little bit of stress always makes us to do better on the part. So we can't totally eliminate stress from our life. What we can do is this, that we can get the cultivate the ways by which the stress doesn't have this negative impact, like sleeping at the right time. I tell
Hmm.
my parents, they don't have anything to for the young kids. You don't have any other burden of, keeping a family, looking after kids. That you should not get sleep at the right time. You must have a good sleep hygiene. You must eat at the right time. You must eat what is suiting you on the part, avoiding junk foods on the part. That is the thing. And most importantly, which I feel strongly feel, is having daily at least 1 hour of physical activity. If you can't go out, do the skipping part, do something which can be done at home also, do the cycling part, maybe do can go out on the part. Because physical activity, 1 hour preferably, at least half an hour can be divided. That really helps you in managing your stress, also releasing those kind of hormones which helps you in the neurostimulants on the part. And that gives you an idea. That gives you also a kind of like a way out to manage these stresses and come out of the headache part. And that has been proven in number of researches also, sir. I think you'll also agree.
Yeah. So that come to the topic is huge stress is required.
True. Very
Yeah.
true. Very, very true.
Rather than the distress,
Right.
if you come to huge stress, definitely there'll be no headache then.
Yeah,
So
very
what are
right.
the tests for headache, common test you will like to advise to the parents that should get it done if there is a headache?
So, practically, we don't require any test for the headache. That's the number one thing, sir. If you are finding this is a primary headache like migraine or tension type headache, which is based on history and examination, we don't require any test for the part. Migraine, tension type headache doesn't require any test. If it is a secondary headaches, like if you find headache because of your refractive error, you go for ophthalmic evaluation. If you find some kind of like pain, tenderness, you get an evaluation done by the ENT. If you are having serious secondary cause of headache as a suspicion, as I mentioned to you, headache at the middle of the night, headache with some other neurological deficits like gait problem, or you're having headache along with some neurocutaneous signs like neurofibromatosis, some kind of like brown spots on the body. In those cases, I ask them to get, evaluated with the physician, pediatrician, neurologist on the part, and get an MRI brain done if required, along with the contrast images, to make sure that we are looking at all the venous sinuses, all the possibilities for the headache in the part.
Hmm. What do you say about EEG then? Is it
EEG,
required?
uh, EEG we don't require for the headache part. That was
Yeah,
the thing. We
yeah,
never
yeah.
require EEG for the headache part. They're very, 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 very uncommon cases of only ictal headaches. So where you
Hmm.
find that the headache is sole manifestation of seizure. So where
Hmm.
as a clinician, you do the EEG during the headache phase and you give the medicines, and the headache and the EEG both improves. But this is, very, very uncommon, almost rare on the part. EEG we don't do for the headache part, sir.
Yeah. Uh, what message you would like to give to the parents, adolescents, and children and teachers of the schools? You know.
Uh, I would say that headache is common in pediatric age group. It's common in children and adolescent on the part. Many
Hmm.
times it's only on the face. It doesn't manifest like you are having some fever, or as I mentioned to you, some kind of like physical illness. But this is as disabling to a child as someone with some kind of like physical, other physical ailment on the part. Second thing is this, that we must cultivate the habit of having sports, some kind of physical activity in daily life, be it as a parent, be it like a teacher, or be it like any caregiver on the part.
Hmm.
Sports
Definitely.
will really help on the part. And third, I will say that we all should be a kind of like a model to tell them that look, how are we using our screen time, how are we sleeping at the right time, how are we eating at the good food, so that they can also follow us on the part. And fourth, because they have their own concerns regarding their stress growing up, challenges, we need to be a kind of like a kind ear to them, guide them on the part. And most often these kids with the headache, they come out of the headache once they start understanding what is causing them the headache part in a way.
थैंक यू प्रवीण जी, आपने काफ़ी डिटेल में हमारे दर्शकों को एंटरटेन करा, आपने नॉलेज बढ़ाया। आपका बहुत बहुत धन्यवाद। आपने अपने बिजी शेड्यूल में से इतना सारा टाइम निकाला, और उम्मीद करता हूँ कि हमारे आईआईपी के पीडियाट्रिशियन, दूसरे पीडियाट्रिशियन, पेरेंट्स और अडोलसेंट इस डिस्कशन को सुनकर कुछ अपने बच्चों का, कुछ खुद का भी भला करेंगे और स्वस्थ रहेंगे। और कुछ प्रॉब्लम हो तो डॉक्टर प्रवीण जी से कांटेक्ट कर सकते हैं, जो कि दिल्ली में बैठे हैं और हमेशा अवेलेबल हैं। और आपके आने का बहुत बहुत धन्यवाद, बहुत बहुत शुक्रिया, बहुत बहुत अभिनंदन। और उम्मीद है कि और किसी नए टॉपिक के साथ हम फिर मिलेंगे। धन्यवाद। Thank you so much for
Thank you, sir.
being with us on
Yeah,
the Dr. Tuteja Talk show. Thank you so much, sir.
thank you, sir. My pleasure, sir. Thank you, sir. Thanks.
Okay.